Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today we welcome Heather Luing. She's a psychiatrist, and today's KevinMD article is Can a Magnet Treat Depression? Heather, welcome to the show.
Thank you. I'm excited to be here.
So let's start by briefly sharing your story and journey.
Yes, well, I'm a psychiatrist. I trained at the University of Florida. I've pretty much spent my career doing all different types of psychiatry within the state of Florida. And I've spent a lot of my time treating very acute patients. So, patients who are hospitalized, acutely suicidal, dealing with really severe depression. And so, over the years, I've really developed a lot of interest in mood disorders and how we can effectively treat those. And that's where I've focused my clinical energy for the last few years.
All right. And your KevinMD article was written a few years ago. Can a magnet treat depression? I'm sure that topic very relevant today. Before talking about the article itself, what led you to write that article on KevinMD in the first place?
Yeah, I think it's interesting in psychiatry because we have historically had really limited ways to treat depression. However, when new opportunities to use different modalities to treat depression do emerge, like TMS did back in 2008, unfortunately, they take a long time to get widely adopted. And so I really wrote the article just to spread the word about other ways to treat depression and hopefully increase awareness.
All right. So when you say TMS, that's of course transcranial magnetic stimulation. So tell us about your article and then TMS in general.
Yes. So my article was written really kind of as a basic primer on TMS, again, to help spread awareness not only to psychiatrists, but really depression ends up impacting all specialists. So whether that's primary care or a different type of specialty, probably every doctor and provider is going to encounter depression. So just understanding that there are other ways to treat depression if medications and therapy alone are not effective.
All right. So what exactly is TMS? And tell us a little bit about the science behind why it works.
Yeah, so TMS is transcranial magnetic stimulation. What it does is it uses a small but high powered magnet to treat a specific area of the brain called the left dorsolateral prefrontal cortex. And what we know from a lot of imaging studies using PET and functional MRI is that in patients with depression, that part of the brain is really hypoactive. And so by using this gentle, non invasive magnetic stimulation, we can activate that part of the brain to work much more normally and really restore the normal working of the brain to treat the depression at the source.
And you mentioned it's non-invasive. So from a patient experience standpoint, just walk us through a typical session. What exactly would that be like for the patient?
Yeah, that's a great question because I think patients have a lot of anxiety when they hear brain stimulation.
Mhm.
It sounds scary. The reality is it's really not. So what it is they'll come in, they'll sit in a reclining type chair. They'll have the magnet applied to this part of the head right here, the left frontal part. And then it's a series of gentle tapping. And so that will go on for 19 minutes. They'll sit there kind of quietly in the chair. A lot of times they can talk to the treater, they can watch television or listen to music. It's really quite relaxing. And at the end, they don't have any change in their normal activities. They can drive, they can go back to work and really do their normal things.
And do they actually feel anything during these 19 minutes?
You do. Probably the way we describe it most commonly is it's like a woodpecker tapping on your head. It's
Mhm.
a strange kind of alien feeling. It's not something that you can probably equate to something else you've felt, but it shouldn't be painful in any way. And the reality is, what you're really experiencing is the scalp, the nerves in the scalp, and those actually toughen up fairly quickly. So the first couple sessions are usually the most intense, and then patients really quickly adapt to it.
So after the initial session, what can a patient expect in terms of how they feel, in terms of onset? What can they expect after that?
They normally feel pretty normally. So there's not a whole lot of side effects, which is one of the great things associated with TMS. The most common side effects, a little bit of scalp tenderness. Second most common is headache. But most of the time, you feel pretty normal after you leave your session, occasionally a little bit tired, occasionally a little bit activated where it's harder to sleep. But for most people, they feel pretty normal. As far as how long it actually takes to work, it's not a super fast acting therapy. So in the clinical trial, it was around the 20th treatment where patients started seeing the positive effects. The treatments themselves are administered of a dose of 36 treatments. So that's 30 treatments Monday through Friday with a 6 treatment taper. So you can see you're about 4 weeks in when the average patient starts seeing that in clinical improvement.
And then would this be used in conjunction with whichever antidepressant medication that patient would come in with?
Yeah, it usually is. The reality is, when they did the clinical trial, they took patients off their antidepressants. So it used a standalone treatment there. But clinically, it has been used much more widely as more of an augmenting agent. So most people, if they've had some improvement on their antidepressant, but not enough to be in remission, they'll continue taking that antidepressant and use the TMS to hopefully drive them into complete remission of symptoms.
So if a patient starts a group of sessions with TMS, we're talking about 4 to 5 weeks, perhaps. Tell us about some of the data about the efficacy behind TMS.
Yeah, so the data is really robust. In the clinical trials, they had about a 70% response rate. So, response being at least a 50% improvement or more in clinical symptoms. And that's really very similar to what we see in clinical practice as well. I think we probably see slightly more than that because of the way we use it as an augmenting agent instead of standalone, but really very similar results.
And in terms of the endurance of these results, do you notice any relapse? How long does this efficacy last for?
Yeah, that's one of the great things about TMS. So, a lot of times, what we find is when a treatment takes a little bit longer to work, sometimes that is countered with it lasts longer. And that's indeed what we see with TMS. So, even though we don't have any cures for depression, we only have treatments, TMS tends to be very long lasting. So, in the clinical trial, if you were a responder to TMS, they followed you out for a year. And
Mhm.
what they found is 80% of those patients were still improved at the end of a year. Now, we at our center have been providing TMS since 2017. I certainly do see some repeat patients, but I also see a lot of patients who have had very long lasting results into multiple years.
And how widely available is TMS? You certainly work in a relatively heavily populated area. Is this readily available throughout the United States?
It is. It's definitely grown in the period of time that we've been involved with TMS, which I think is wonderful because it really needs to be in every community. And in fact, that was actually our motivation originally for starting a TMS center, was that we couldn't get our inpatients into TMS treatment that was close by and quick enough that they could actually get in without a long waiting list. But more and more centers have opened, more and more manufacturers are making TMS machines. So I do think it's something that if someone is interested in, they will be able to find, if not one, multiple centers in their area.
So, give us a couple of case studies of a typical patient that you would see as a good candidate for TMS, just to bring everything that you said into a better illustration. What typical patients would you see that would be appropriate candidates for this?
Yeah, so the American Psychiatric Association actually recommends TMS as second line treatment. So after one inadequate response to an oral antidepressant. In reality, because of insurance constraints, patients do often have to be a bit more treatment resistant to access this. In general, though, 2 antidepressant failures, sometimes plus or minus an augmenting agent, is enough for somebody to meet criteria and be a good candidate. And in fact, if we treat patients with these modalities earlier in the course of their illness, we have a much better chance of getting them into full remission. So I would really argue anyone who's had an inadequate response on 2 antidepressants and is interested in TMS is actually a really good candidate.
And in any difference in terms of the age of the patients, in terms of their response and tolerance of the treatment?
It is FDA approved for 18 and up. There was a recent study that one of the TMS machines has done with adolescents. So I think that is going to allow 15 and up to eventually have insurance coverage for this treatment. And there's really no upper limit because of the fact that it's such a safe treatment. There's so few side effects. It's actually a great treatment for people with other medical conditions, for people who are elderly and more complex, and also for people kind of with special situations, like maybe they're having renal impairment or hepatic impairment that make medications difficult. Also, a great option for lactating mothers. So, I think there's really a lot of patients that it's an ideal fit for.
So I treat a lot of patients with medications for depression in my own primary care clinic. What would you define as a treatment failure? What would that look like in a primary care setting?
Yeah, so really, we define treatment response as 50% or more improvement. So if you have less than 25% improvement, then you're a non responder. If you fall between that 25 and 50%, that's an inadequate response. So it's really anyone who just the med hasn't worked for them, or it hasn't worked well enough to get that 50% improvement, or they don't tolerate it due to side effects.
And as you know, there's a little bit of a stigma associated with TMS due to mainstream media, a lot of misperceptions. So, say in a primary care setting, and if a patient what you thought was an appropriate candidate for TMS, how would you bring up that potential option with that patient, knowing that there's a little bit of a stigma associated with it?
Yeah, it's really sad that in mental health in general, there's still stigma. So I hear from some of the primary care doctors in my community that I work with, even when they recommend psychiatry, sometimes there's pushback from patients. But I think, obviously when you're in primary care, you're going to have a very good relationship with your patient with good rapport. I think if you can recommend seeing a specialist like a psychiatrist or a specialized service like TMS, and really, show them that you believe in this, that it's scientifically rigorous, we have FDA approval. I think those things really go a long way in cutting down stigma. I think essentially, education is so important. And as a doctor, I see myself as one of my primary roles in educating patients. And I think when we're treating patients with depression, in order to really be getting informed consent from them, they should know what all the FDA approved options are, which includes TMS, but it also includes some of our newer medications that a lot of people don't always think about. So I think just talking about it helps a lot.
So now that you have this platform, any misperceptions specifically about TMS that you typically see on social media or mainstream media that you like to clear up?
Yeah, I think for one thing that it's invasive. It is considered a non-invasive treatment, and it's really one of the most sort of benign as far as side effect profile things that we do in psychiatry. So that would probably be the first one. Maybe the second one would be that it would be painful. And I have really just not found that to be true. If you have somebody who's a skilled TMS provider, they will start TMS in a nice, slow, gentle way and make it very tolerable for our patients.
All right. So, having listened to everything you said, give us a case study. Tell us a success story where TMS really made an appreciable difference in a patient's life. And certainly, it could be a hypothetical, it could be an amalgamation of cases, but give us a sample case study, kind of a before and after.
Yeah. I feel so lucky that this is what I get to do all day. So I see these patients literally on a daily basis. But I think probably some of the more dramatic cases I have seen have been individuals that I've met on an inpatient unit. So I remember one gentleman in particular, really a high functioning individual, very well educated in a job where, really well respected in the community. And he was just still struggling with severe depression, with suicidal ideations, was kind of at the point where he felt ready to give up. He tried medications, they hadn't worked, really felt like he was at the end of the road and hadn't heard of TMS. His psychiatrist hadn't ever told him about it. So when I brought it up to him, talked with him and his wife, they were very receptive, but still a little bit doubtful that this would give them the relief that they were looking for. And we brought him into the center as soon as he was discharged from the hospital, started his treatments, went into a full remission. And just the gratitude and thankfulness from him and his family is something that I think I'll carry with me for the rest of my life.
And is depression the only behavioral health condition that TMS is indicated for?
So it's the most widely used. Depending on where you are in the world, there's going to be different indications for TMS. And in the US, traditionally, it has been treatment resistant depression that has been accessed with TMS. But there, depending on the machine, are now also indications for OCD, for depression with anxious distress, now the new adolescent depression indication, and also a really exciting but not funded by insurance indication of tobacco cessation.
Mm.
So I think that when you look at device companies versus pharmaceutical companies, it takes a lot longer for us to get indications for devices, and it can take a lot longer too for insurance to start covering those. But I anticipate, in the next 10 years, we're going to have a lot more access to TMS for different psychiatric disorders.
And to be clear, Medicare and most commercial insurers cover it for treatment-resistant depression?
They do. In fact, Medicare is one of the best. In our particular Medicare setting, it's actually only one antidepressant failure required for Medicare patients. And if they have a secondary insurance, it's zero out of pocket cost for them. So, really exciting. And most commercial plans, the VA, some states' Medicaid plans will also cover it.
So, in terms of the future of TMS, where do you envision it to go? Any new innovations on horizon in terms of the direction of TMS in the next couple of years?
I think we'll see more kind of movement in treating anxiety disorders and treating substance use disorders. So, depending on where you stimulate the brain, what sort of frequency you're using for stimulation, there's different protocols that are currently used either on an experimental basis or in some places in an approved basis to treat these disorders. So when we think about the brain, we want to challenge ourselves to not think about it simply in terms of chemicals, but also to think of it in terms of circuits. And circuits are really what we're targeting with TMS. So I think we've only scratched the surface of its clinical utility.
Now, for the patients who may be listening to you and may be interested in TMS, what kind of questions should they ask to determine whether that's the right treatment for them, whether that doctor is the, reputable doctor? Obviously, you work for a TMS center. So what kind of questions should patients ask if they want to move forward with potential TMS?
Well, I think, important question to ask is, do they meet the criteria? Or is their insurance going to cover it? And what would the cost be for them out of pocket are always important questions. And when looking for someone to treat with TMS, I would encourage them to look for a board certified psychiatrist. By the time patients are getting TMS treatment, it is a specialized treatment. And a board certified psychiatrist is going to have the correct training to really be able to manage that as far as TMS, but also any medications or contraindications that they may have.
And certainly is TMS included in terms of the board certification for psychiatrist training?
Yes and no. So, depending on when you've gone through training, most psychiatrists will have an option to have some exposure to TMS. But I think it's still underutilized even in some academic programs. There's not a subspecialty at this point specifically for interventional psychiatry, but interventional psychiatry is a growing subspecialty. And so, what you'll find is people will seek out additional training opportunities. Certain academic facilities offer them. The TMS Society offers a training called Pulses several times a year. So, that's usually where further training is obtained by psychiatrists.
We're talking to Heather Luing. She's a psychiatrist. Today's Kevin MD article is Can a Magnet Treat Depression? Heather, we'll end with some of your take home messages that you want to leave with the Kevin MD audience.
My biggest take home for the audience is that depression is a treatable condition. And the reality is, in the US, many people are untreated or ineffectively treated for depression. This is a really exciting time in psychiatry for depression treatment because we have so many more options now available than we did, and so many more that are in the pipeline for development. So it's really a time of hope, of opportunity to find an effective treatment. So my, message really is find somebody who can help you get your depression into remission. And if you're treating patients with depression, have remission be the goal.
Heather, thank you so much for sharing your perspective and insight. And thanks again for coming on the show.
Thank you. It was my pleasure.